Welcome, everyone, to today's show. I'm Jeja Flazanes, your host and producer. Thank you for downloading today's episode. Today, we're going to talk about biological dentistry and oral health. I am excited and excited. Here's where I'm not excited. I apologize in advance because I don't know what happened. My gain got turned down on my microphone and it was plugged in. I was on the right channel. And for some reason, I sound like I'm in a black hole. It's not horrible, but it isn't great. And you know how I feel about sound quality. However, because this show is so amazing and packed with amazing information that you need to know now, I didn't want to redo it and wait. So please forgive me. And again, like I said, you'll get used to it. It's not horrible, but Dr. Sanda sounds amazing and wonderful. Two announcements before we continue on to today's show. She's going to talk about some products that she has. One of them is an oral probiotic in the form of a mint, and you chew it and put it in your mouth to help with the probiotics in your mouth to help heal gum disease and other things that we're going to talk about. And what we did after we recorded the show was create a special discount for you, my listeners. So 2 links, and again, these will all be in the show notes. All her website addresses are in the show notes, but you can also go to jjflazanes.com/dentist. So that'll be easy to remember, jjflazanes.com/dentist. And you can type in 5 new, so capital NEW with a exclamation point, 5 new exclamation point to get $5 off if you want to try these oral probiotics. And again, look in the show notes if you're driving or running or walking and you're not able to write this all down. The last announcement that I'll make before we continue the show is that I'm doing a webinar on Wednesday, October 28th at 5 p.m. Pacific, 8 p.m. Eastern on growing your business with the law of attraction. So this would be for anyone who already has a business, someone who has a side business, or someone wanting to start a business. Again, growing your business with the law of attraction. And you can go to jjflazanes.com/LOA, that's law of attraction, LOA biz, B-I-Z. jjflazanes.com/LOA biz, law of attraction biz. All right. And again, that's Wednesday, October 28th. And if you come live, I will have some special gifts for you, only for those that come live. So make sure to register, get it on your calendar, and look forward to helping you grow your business with the law of attraction. So now on to today's show. Dr. Sanda Moldovan is recognized internationally as a speaker and author for her expertise in oral health, nutrition, and dental implant surgery. With 2 board certifications, periodontics and nutrition, she brings an uncommon level of well-rounded knowledge to biological dentistry. She says, "The mouth is the gateway to your health." She founded Beverly Hills Dental Health and Wellness, a biological dental office, and Orasana, offering natural oral health solutions that nourish the mouth. Welcome to the show, everyone. Today's a special treat because I have had this podcast now for 6 years, and I have yet to do a session or an episode on dentistry. And can I tell you how many times I've wanted to find a natural, more kind of up-to-date dentist with some of the information that I've got, which I'm going to ask you about, Dr. Sanda. So I'm excited today. If you're watching today on YouTube, know that I've done an intro and there's a little bit more information on the podcast. So if you click a link below, you can take the podcast with you in the car and just listen. And if you're listening to this on the podcast and you want to see the video, come on over to jjflazanes.tv. So Dr. Sanda, thank you for being here today.
Thank you very much for having me.
So let's talk about dentistry. And I want to first start with a hot topic that I've been talking about for years. I learned it through Dr. Blaylock. It probably came through Suzanne Summers as well. Can we just start with, and then I know we're going to go into your whole position on dentistry, but can we please still start with fluoride? Isn't fluoride toxic?
Yes, absolutely. It is toxic. And there's been a couple of documentaries that are featuring exactly just how toxic it is and how fluoride ended up in the water. And just recently, actually, there's been a drop in the amount of fluoride in the water, but it's not sufficient enough. I mean, we have studies to show that kids, school 5th through 8th grade, they actually have a lowered IQ if they have higher levels of fluoride. So we know this calcifies the pituitary gland, but yet it's still something that's out there in the water today.
I was recently at the dentist. And this is how you're with me right now. This is how this happened, right? And I teach law of attraction, so I'm a big contrast creates clarity, and you take action, and there's divine timing.
So I had been going to a dentist. I have 2 dental hygienists that I'm friends with, and one of them have cleaned my teeth for me. So I go to this other dentist that I have seen off and on, between another one who retired, who did great. He took out my amalgams, put some porcelain in, loved that dentist.
Right.
He retired, had to go back to this other dentist. And I'm literally in the chair, and every time I'm there, my intuition says, why are you here? You don't agree with anything they do. And the hygienist is cleaning my teeth, again, not doing a very good job because it's, short amount of time. Dentist comes over and he says whatever he says to me, and they're always giving me fluoride, and they're always wanting to do, fluoride kind of things. And there's no new talk of anything, oil pulling, like it's all, we can't talk about any of that. That may or may not work. It's not proven. And I'm literally sitting in the chair, and I've gone through some medical things recently, like where, I followed my intuition with some fibroids, and I didn't listen to the doctors on pretty much anything they said. And I researched what to do, and I partially healed naturally, and then did a therapy that was told I couldn't do it, and I did it anyway. I'm all better is the point. Okay, I listened to my intuition. Yeah. I'm all better. So I'm in the chair, and the dentist, says what he says to me. And I'm thinking to myself, it took this much time for me to realize, why do I go to this guy? I go to this guy because our mutual connection, Jeannie Peters, I'm like, he is connected to her in some way. So I automatically said, oh, well, then he must be into natural remedies, into, anything natural and alternative. And she said, no, why would you think that? I'm like, I don't know. I assumed it. And every time I go back, I cringe thinking, why am I here? So I finally said, Jeannie, give me a dentist that I can work with that is not in the dark ages of all this crap. And so she's like, oh, you'll love Sanda. So I
welcome you to come to our office and experience an all natural hygiene. That's no fluoride anywhere in our office.
I love you already. Yeah. I love you already. And I will. And my partner Doug said to me, oh, I have to go to the dentist. I said, stop, don't go yet. I'm going to interview Dr. Sanda. You're going to go to her. I mean, I even already told him he's coming to you before he even knew this was happening. So let's start with, and I can't wait to meet you. And I will drive from wherever I am to come to you, because I'm tired of fighting this old archaic system of ridiculous. It takes 17 years to change a paradigm, when we have research and understandings that people are just so blind to. So can we start off with your story about how you became a dentist, and why, and then be like, how, because I also know that you're a nutritionist too, right? You're
I am, yes.
You do biological dentistry and oral health. So you're a nutritionist as well as a dentist. And then of course, you're on the cutting edge. You're the equivalent to Jeannie's functional medicine and to all the alternative medicine in terms of taking that next step. So can you tell us your story about how you got here?
Definitely. And, I also wrote actually in the introduction of my book how exactly I got to all this, and my story about how I grew up in Romania. And the book is called Heal Up. It's on Amazon if anybody's interested. But essentially everything comes back as a knowledge to be used later on in life, what I found. I wanted to go to medical school because I had such a love for biology. I was so inquisitive about how things are working, how cells respond to this and that. And I didn't end up going to medical school because I met somebody when I was in college that was a dental specialist. And he said, hey, you want to help me with my research? So I started that direction, and I started to understand, like, there's so much happening in the mouth, that, such a dynamic place, and it's so important for overall health. I mean, I believe the mouth is a gateway to your health from many different aspects. I went to dental school. I got in early, and at an early stage in dental school, I knew that I didn't want to do just fillings. Because, drill and fill is one of those things that wasn't exciting for me. What really I was passionate about is biology. And the field of periodontics was very interesting to me, because there were a lot of different things going on between the biofilm, the bacteria, viruses, things happening in the mouth, the inflammation status, and how things travel through your body. So I ended up going to periodontal residency at UCLA in 2001. But then one thing was always a big dilemma for me. Why two patients we're doing exactly the same things, one heals great and another one doesn't? I didn't understand that, and it wasn't really explained well in school. And I started going to nutritional conferences and medical conferences, like the Functional Medicine Academy, or nutritional classes. That's how I met Jeannie, actually, 15 years ago. And I started playing around with nutrition. And I applied certain principles that I learned to some of my patients suffering from advanced periodontal disease and needing reconstruction of bone, and they healed better. So I realized what a huge role nutrition plays in dental health and overall health and healing. And that's how I ended up going through this, field of natural medicine. And through applying it, I realized it has a huge factor, and it's not really taught in school, unfortunately. I was just inquisitive. I'm still learning every day. There's so many studies on the microbiome, which is fascinating to me. So yeah, this is where we are today.
Jeannie said that what would really be exciting for me to talk to you about is the probiotics for the mouth.
Yes. The field of probiotics has really exploded, but mostly for the gut. Only in really, I would say, the last 5 years, we started looking into probiotics for the mouth. And most of the time when I ask people, do you take a probiotic? Most everybody does nowadays, because we understand how important they are for gut health. But for the mouth, I was actually involved, and I am involved with, I founded a company called Orasana, and we have a vegan probiotic mint that has been shown to help with inflammation, not only of the oral cavity, but the nose and throat, the sinuses. And there's 5 bacterial strains that have a lot of research to show that not only it reduces cavities, which is pretty amazing. We didn't know that just by introducing a different type of bacteria in the mouth, we can lower the rate of decay, which was fascinating. Also, the rate of gum disease. We are able to lower the rate of gum disease just by doing things at home, which is what's exciting. So for people that were recommending like deep cleanings at the dentist, try starting at home first. And that's how we start in our practice. We give them the tools to use a water jet and to turn over the bacteria at home. And a lot of our patients see great results just by doing things at home, not necessarily jumping into expensive dental treatments.
Yeah, I just had a deep cleaning, and I have a hole in my tooth now because it was cleaned so well, and on one side the gums retracted back into the tooth, but now I have a hole, and so I'm wanting to stimulate healing, which I'm doing a bunch of things. But talk to me about this. So, is it the company that you started that sells the gum that you said?
It's a probiotic mint, actually. So it refreshes your breath, but also kind of forms a coating to help with the bacterial overload on the tongue and the cheeks, the gums, the teeth, the throat.
And where do we get this? Where do we get this? I'm ready to buy now.
Exactly. So we sell it on Amazon.com. We sell it at Erewhon, actually, in their aisles there of natural supplements, online at orasana.com.
Can we spell that?
And and it was very important for me that I work with probiotics that are vegan certified, because we have a lot of patients that are sensitive to lactose nowadays, and a lot of the probiotics are grown on some kind of milk base. So it's important to choose something for patients, especially that are sensitive to a lot of allergens. But what's the problem with the mouth? We have 700 different kinds of bacteria in the mouth, and traditionally, like you experience, we recommend anybody with inflamed gums deep cleanings. We treated everyone the same, like everyone had the same bacteria. But nowadays we can actually do a saliva test, and we can tell everybody's fingerprint of their bacteria in the mouth. So somebody with inflammation might have really high levels of bacteria, but somebody else with inflammation might not. They might have a different issue. Like, for example, lack of iron that can actually cause inflamed gums. So we can identify how to better treat people. And what we're trying to do now, like instead of just the deep cleaning, is trying to reverse the flora in the mouth, kind of help it build a better flora. Because a lot of my patients come in and say, oh my God, how can I scrub my teeth better? But it's not about that. It's not about trying to eliminate all bacteria. We know we are like 10-1 outnumbered, essentially. There's 10 times more bacteria than there's human cells on our body. So we're never going to win that war of, sterilizing our mouth. We just have to build a better bacterial biofilm or better bacteria in the mouth through the use of probiotics, through the use of natural things. Nothing harsh, that really, like some of the mouthwashes that are typically used after deep cleaning, they have pesticides in them, like chlorhexidine. It's used as a pesticide in the field. Why would I put that in my mouth? So that's not something that we recommend at all as a biological dental office. But there's lots of dentists that's their go-to for any kind of inflammation of the mouth.
Well, because it's not connected to some kind of pharmaceutical distribution center that's created some kind of thing that has fluoride and dye number five, blue dye number 5 or whatever it is, right? They're all blue. It's like it's to make you feel calm or something. I'm like, there's dye in it. Why would I need to put something with dye in my mouth? Anyway, yeah, you're hitting on some really very like Listerine. Listerine. Let's talk about Listerine.
Oh my gosh.
Listerine?
Yeah, let's talk about that. I mean, the pH of Listerine is 3.5. It's basically the same pH of wine or, vodka. So basically, if you were to take vodka and swish with it for a minute, it's not healthy to do that. A pH of 3.5 demineralizes the teeth. So most people that are actually using Listerine typically report sensitivity. Why? Because they're breaking down the enamel anytime they swish with Listerine. So, or any other mouthwash that has a low pH like that. So definitely avoid any kind of mouthwashes with alcohol and anything that has a pH that low to swish with or be in the mouth for, over a minute.
Okay. Do you sell mouthwash too?
Well, it's interesting with mouthwash. I don't, but we do have a great natural mouthwash that we use. It was actually started by hygienists. I love this mouthwash because it's aloe vera based and it has a lot of essential oils and wheatgrass. And they've done a lot of studies on it to show that it actually kills periodontal pathogens just as well as the toxic mouthwash, the periodontics that we typically use. So I do support them. And it's a mouthwash that we do offer in our office because it has clinical research, number one, because I want something that's effective. As a periodontist, I cannot use something that doesn't have research that it works. I have to recommend something that works. So yeah, there's a lot of good options out there. In dentistry, I think we're living really good times that we have much better choices to offer patients. Instead of the old traditional scraping, we now use something called an airflow, which is glycine. It's like a glycine spray, like a glycine shower for your teeth that removes biofilm without actually scraping. So there's a lot of other options that are a lot gentler and not painful.
Well, I know most people fear the dentist for that very reason, for the painful part. But let's go back to this because I know I can see you, but I have people who listen to the show all over the world. Let's talk about the probiotic part and what you can help anybody with. And is it someone, someone in another country, someone in a different part of this country?
Yes.
Are you able to help them with this test for the flora in the mouth and then with prescriptions of the right kind of bacteria, right kind of probiotics that they should be using?
Yes, definitely. So the era we live in today, we're doing a lot of virtual consultations, and we do send out saliva tests for patients. Actually, we've been contacted by patients from all over the United States, and we do send a saliva kit out. It's an easy test. You actually, it's a little bottle. You take it, swish with it for 30 minutes, you gargle, and spit it back in a test tube, and we ship it out to the company.
You mean 30 seconds? You said 30 minutes.
Seconds. Oh, so sorry, 30 seconds.
That's okay.
Yeah.
I just want to make sure you said 30 minutes. And I'm like, 30 minutes? I'm supposed to swish? I can barely swish for 3 minutes. Okay,
yeah, I agree with you. So 30 seconds, and then you gargle, spit back in a test tube, send it out to a company called Oral DNA, which is part of a big lab called Quest. Very accurate testing. We look for 11 different periodontal pathogens, or we can also look for cavity-causing bacteria. Because it's good to know people that are suffering from cavities are different than people suffering from gum disease. But what we do know that a healthy biofilm protects the mouth against both of those diseases. And, cavities is the number one disease in children today. And it's still happening. And mostly it's back because of all the, ADD medication that's causing dry mouth in kids today. So probiotics, the way probiotics work, if we know whether bacteria is, usually we also help them with cleaning better. So once we have it cleaned better, then the probiotic, and it works best at night. Why? Because our mouth is the driest. So I always recommend patients take a probiotic, let it dissolve in your mouth, then take your tongue and kind of move it around the outer surfaces of the teeth just to get it to coat everywhere. And go to sleep. That should be the last thing before you go to bed. When the mouth is the driest, then it really gives a chance for these microorganisms to attach into the layer of biofilm. And biofilm is really like a coat that exists on all our skin and our mouth, on our teeth. When you get a dental cleaning, we actually wipe off that biofilm, but it grows back within an hour. That's how fast it grows back. And we want it growing back in a healthy way. What we do know that some bacteria actually has the ability to kick off a different bacteria and put itself in there, which is pretty interesting that it actually has this dynamic thing. And that's what we really want from a good probiotic formula. And probiotics not only help with the inflammation of the gums, and the way it does that is actually very interesting. It not only reduces the level of plaque that we see on the teeth, but we looked at the inflammatory molecules in the blood and in the saliva, and it actually lowers those inflammatory molecules. And why? Because bacteria talks to our genes, it talks to our cells, it tells it what to do. So that's the exciting part about this, that we actually know how bacteria interacts with our cells.
Do you have oral probiotics for animals?
That's a good point. No, but I know there are oral probiotics out there for animals. We don't have a formula like that. But I think the important thing for animals, we cannot have any xylitol in the formula. And the reason why for humans xylitol is important because it actually suppresses the growth of bad bacteria. So we like to put in our formulation for that reason. And we've had great testimonials from probiotics, even for people that have had sinus problems. And their sinus have gotten significantly better and clearer through the use of oral probiotics.
And when we mention oral probiotics, it's meaning for your mouth, not right, because all probiotics get digested, so they all go in the mouth, but they're not. But these are specifically for the mouth, not for the gut.
So the way we define an oral probiotics, they have to be left in the mouth to dissolve. So you could chew them or let them dissolve, so they actually stay in the mouth. Some of it, of course, through the saliva is going to trickle down to the intestinal tract, but most of it will have an effect in the oral cavity, the nasal cavity, and the sinus. We've had some reports that the chewable probiotics do help with the opening of the stomach, the esophagus. As they trickle down in that area, they can help calm down inflammation in that tissue. So that's exciting. One of the things we have seen as a side effect of chewing probiotic mints.
Well, is there a side effect of, I don't know why this just came into my awareness. I had this thought because you mentioned sinuses. So if people open up their sinuses, can they help like snoring? That's not me. I'm thinking of other people.
Yeah. I don't know. We haven't done the research in that department with the snoring, but that's a great idea because snoring is really inflammation. Sleep apnea is inflammation of the GI tract. So could it help with that? Perhaps, but I don't think anybody's looked into that aspect yet. We're really in the infancy of the research on oral probiotics, but that's a great idea. I'm going to take it.
Please take it and come back to me and let me know because I do, and I'm glad you just said that, because in terms of sleep apnea, again, here's where, to me, if we're not looking at the bigger picture and of health, of all aspects of health, it's like, oh, you have a breathing problem. I don't know. What are you eating? Are you inflamed? Oh, let's not look at that. Let's just have a sleep test and see if you can breathe. Well, there's a reason why you're not breathing, right? And it's like, we're not looking at the whole picture, and we're going in and we're doing all this work, and then we're going to put someone on a machine to sleep at night. Yeah. Anyway, it feels very disconnected, and it feels like not the right, it's like there's something more simple. There's something closer to home. There's something out of balance in your body. And when you said it opens up the sinuses or it helps with sinuses, immediately I thought of people who snore, who I know have inflammation because they're unwilling to give up dairy, or they, have inflammation for other toxic reasons and aren't willing to change those habits. But I'm like, man, if you could just get into the mouth and add some probiotics and that helps, maybe that would help some people that have chronic snoring issues.
Yeah, that would be a great study. Yeah.
So take it, please let me know. Because I'd love to promote that. I mean, that's a huge thing. So, on the topic of dentistry, and again, it's like, Dr. Blaylock did his whole thing on the toxicity of fluoride. And God, I probably learned that 15 years ago, maybe even longer than that, maybe like 17 years ago. And, of course, it's in your toothpaste, people. And it's like, it does say, don't swallow. Like at some point you have to ask the question, if you can't swallow your toothpaste, should you be putting it in your mouth? And because, again, it's such a common accepted, well, my dentist said so. Well, my doctor said so. Well, ask some questions and read things, people. You are not a victim. You are being asked to do something, but you are allowed to ask questions and understand, everyone's human here and everyone has access literally to the same information that you could research on. And so I switched my toxic toothpaste years ago and try to, encourage other people to, but no one questions it. And, fluoride in the water, like that's a whole topic in itself. But I don't want to go down that route as much unless people come back and tell me they want to learn more about how negative fluoride is not only in your toothpaste, switch your toothpaste, or in your water, which we can't do anything about right now. I'm sure we could vote to have someone take it out, but
we can filter it. Exactly. We can filter it at home and just be conscious about what we drink.
Yes. So absolutely do that. But one of the things that I also came up in my last dentist appointment that led me to this conversation, thank God, was when Jeannie had said that because she goes to this person occasionally and she got a cleaning or something and he looked at her mouth and she had a cavity and he said, well, we need to do this. And she said, stop, I'm going to go try to heal it myself. And then she came back and she had healed it. And he said, well, I don't know how you did that, but I can't recommend that. It's great what you did. Yay for you. But I can't tell other people to do that because it's scientifically unproven. And it was
so is fluoride, by the way. Fluoride for adults is scientifically unproven. Because I looked into this as part of our association of IAOMT, which is the Biological Dentistry Association, International Association of Oral Medicine and Toxicology. And we are actually in the process of suing the federal government for the last few years to get rid of mercury in the United States because it's toxic. We all know it's toxic, yet we're still putting in kids. But same with fluoride. Fluoride for adults, most adults don't have a cavity problem. They don't. Unless you have really dry mouth. So we don't need to use fluoride, but a lot of dentists use it because they get reimbursed by the insurance, typically, from using a fluoride topical application in the dental office. And also in the toothpaste, there's actually no evidence that fluoride in toothpaste helps anybody. But it's been really like the brainwashing of dental schools that has led to all dentists kind of repeating the same information without being inquisitive and say, hey, is this really working? Does this really have scientific background? It really doesn't.
Thank you. No, I know. And I pushed up against it again with one person. I don't like thinking the hygienist would look at me and say, after he'd leave, she'd say, you're not going to do any of that, are you? I went, no. But I'm like, and I don't have insurance. I'm like not paying with insurance or anything. There's like, why do I keep going? And I don't know, it wasn't a big of a deal until it was a big deal. And I'm like, this is enough. Enough is enough. I've had enough. Get out of this conscious relationship. Not to mention I have been looking for you, basically. So I'm glad to have finally found you. Now let's talk about this whole cavities being reversed. I know what Jeannie did, but you have it also. And is it just about the probiotics, or let's talk a little bit about how people can reverse cavities?
Yeah, definitely. And this is a lot of research that I had to do because in school, basically, we're taught, okay, you have a cavity, okay, you clean it out and you fill it. That's basically the end of that. There's no other treatment in between. But if we go back and look at even some of the research done in the 1920s, 1930s, they were looking at, hey, can teeth grow back? And, a tooth is an organ. And the reason why we qualify it as an organ is because it's got its own blood system, it's got its own nervous system through which it functions. So typically, if a tooth is alive, not a one with a root canal tooth is dead. That's a whole nother topic. But when a tooth is alive, it can actually remineralize areas of decay. Now, if the decay is very deep and it's actually past, closer to the nerve, unfortunately, there's no way for anything to kill that bacteria that's in the tooth. And that's the limiting factor. Cavities are really caused by certain bacteria. So if it's an area that's just in the enamel, those can be absolutely reversed just through using different oral care, such as a water jet, using also certain minerals, such as a nanoparticle hydroxyapatite calcium, which is what the tooth is made out of. So it has nothing to do with fluoride. What we really need is topical application of calcium on the teeth. Cavities, as it turns out, it's also a problem of absorption. So some kids that we are seeing that are having rampant decay today, even though, they they basically eat healthy, their moms are all naturals, like, why is my kid having all these cavities? And leaky gut is a huge problem. And it actually, that's why the mouth is a gateway to your health. We see what's going on. But if you see somebody with rampant decay, they have a digestive problems. That's what we need to really address. How do we correct the digestion? Yes, we can help the teeth along, but if the digestive problems are not addressed, cavities will continue.
I'm thinking about my cat. I'm thinking about, which is why I asked you about animals because I do a probiotic, and I'm thinking, okay, how would I handle that with my cat? But in terms of people, I do agree, and I'm glad you brought that up too, the connection between leaky gut and digestion and our health. I mean, digestion in really all parts of our bodies, right? But definitely you can see it in the teeth. And so now because I know people are listening and thinking, well, I want to work with her. I want this information. So can we just go through before, and I still have more things to talk to you about, but I just want to make sure people can just, because I want to be calm, I can come see you, but someone else who lives in the other part of the world, who won't be able to come and see you as the dentist, wants this information about how to help the probiotic health of their mouth and be able to, again, help them not get cavities, help heal any that might be there, to work on their gums, and to do it in a way that's not invasive, that hurts, and that's super expensive to start, because it's very proactive. And that's, I like to give people tools in terms of what they can do. And like you just said, half of the stuff they can do at home, and they can do a better job, and then it alleviates the need to come in. So you're not that auto body shop that wants to take advantage of everybody and says, yep, all these problems, here's what the price is going to be. And I've had dentists do that too. I've had dentists who have said, I thought I had a cavity. Someone said I had a cavity, and they were in Beverly Hills, and I knew her personally, and I got this humongous bill, and I thought, what? And I was in shock. And then I went to a dentist in Pennsylvania when I was home visiting my parents, and they looked, and they're like, you don't have a cavity. So whether it healed between the time I saw her and the time I went home, or she saw something that wasn't there, or they didn't see something, I mean, nothing ever happened. But sometimes people don't trust certain doctors because of the way that people have been prescribed before. It's like, here, let me write up every most expensive treatment that you actually really don't need, but would be good for you. It's like, even though you don't need it right now, but you eventually will. So just do it, all of it. Every time I go to so I want to make sure people understand that they can, with you. So let's walk through really quickly. I call you, I live in another part of the country or in a different country, or I write to you, and then I want to do this test. So what happens next?
Yeah. So basically I have a quick chat. We then have to fill out a medical history. I want to know what the problem is. Then I get on the phone with somebody who's interested in utilizing us for our dental services, and then ask them what the problem is. I ask them about their digestion, or what do you eat? How are your habits? I need to understand all this because, there's a lot of factors why somebody get cavities. So I need to pinpoint exactly. My role is pinpoint exactly what is the problem. Is it because of a sugary, carbohydrate high diet that we're getting cavities? We need to work on that, not just, oral hygiene. Or is it more like I'm doing everything healthy, but I have a dry mouth, I'm still getting cavity? Then we need to look at other things. But the most important thing is definitely oral hygiene and applying the right mineralization material on the teeth. It could be in the form of a paste, but also taking certain supplements. So we know teeth can heal if they have the right balance between phosphorus and calcium. That balance is very, very important. And actually part of the Orasana line, probably in the next month, we're going to have a new product that is going to be out to be taken systemically in the right phosphorus and calcium balance. Because what I found, I was looking for my patients to recommend for them calcium, phosphorus in the right balance. I couldn't find a product. There's nothing like that out there. And especially from like a vegan perspective, people that are, for certain reasons, they have to hold a certain diet, and they're not getting the right phosphorus and calcium balance, and they end up with weaker teeth. Either they're chipping, breaking, and also prone to cavities. We figure out what it is. We get the results of the saliva to see the cavity risk. Basically, we look how much bacteria is really there that causes cavity. If it's not that much, then we know it's a systemic problem. And then I create a plan for them and say, okay, let's work on, diet like this, supplements, oral health. And these are things they can actually do at home. And then we reevaluate things. Usually 6 months later, I would need to see some kind of x-rays. X-rays are a good indication for me to see, hey, are these teeth healing? Because we can see the density of a tooth on x-ray versus just me seeing it clinically. And oftentimes we see the density of the tooth actually is much better 6 months after following a program.
Well, the good news is I just had the x-rays, and from what I was looking at, everything looked really good. It was more about the gum thing, because they went all the way to the root, right? So they were looking at roots, and everything was fine, and there was no problem there. It was more about gum, and then what that would lead to in the future if it wasn't reversed. And when Jeannie said oral probiotics for your mouth, I thought, oh, perfect. That would be great. So that saliva test that people take, is that what it's doing when they take this saliva test? Is they're telling that the composition of their mouth and so that you can supplement and balance that out?
Yes, exactly. So it tells me 11 different pathogens that we know cause gum disease. And you know what's interesting? Some of these pathogens have been recently studies to show that they're not just a problem for the mouth, but they also, for example, Fusobacterium, which also causes bad breath, it's a certain bacteria, it can cause a higher incidence of tumors down in the digestive tract. How it does that, we don't know, but that's another reason why we're so interested in how the mouth is doing. So, Porphyromonas gingivalis, another aggressive periodontal pathogen, has been shown to be found in the brain and abscesses in the brain and Alzheimer brain. So we know we don't want this bacteria in the mouth. They're not normally present there. Usually we inherit them from either a partner through saliva or our parents pass them down. So now that we can pinpoint exactly, and it also, the saliva test tells me in what kind of numbers this organism is present. So if it's really high numbers, it's a big problem. We want to definitely start to minimize that and do something systemically as well. And systemically, what I mean is certain herbal supplements that are antibacterial, antiparasitic are great for gum disease as support. So yeah, people that have one or two microorganisms that are just out of whack compared to, like, say, all 11 of them, those are easier to control. So those typically can be reversed with doing things more minimally invasive, like basically the deep cleaning that you had, maybe using ozone therapy to just wipe out everything that lives first and just kind of build it back up. Ozone therapy is something we use all the time in our practice. And if somebody has the ability to do ozone water at home, I highly recommend that they get an ozone generator at home so they can make ozone water for their water jet, especially somebody suffering from gum disease and bone loss. Mm-hmm. And then after that, take the probiotics recommended, and depends on the frequency of them. If somebody has a big problem, then you take just more of them, and because we need a more intense treatment.
It's funny you brought up ozone healing, because so speaking of my cat, I have taken one, and now I'm going to take another cat for ozone therapy in the pet world. And it's funny because I hadn't even thought about using it for myself. And I just bought a water pick. And I did think about that, like, what could I put in here that would make it more effective? And the fact that you're saying, to actually get an ozone generator. So what I'm actually doing is helping the mouse just get rid of any of the pathogens, right?
Yes. Mm-hmm.
Okay, perfect. Well, I'm going to get an ozone generator. So cavities can be reversed. Now, what's the problem with root canals? Let's talk about, we're talking about biological dentistry and oral health on a more natural, but not meaning like not scientifically proven, everybody who's listening, right? We're talking about everything that is new and that we've gone a little too far, probably in one direction in dentistry. And I'm guessing root canals is one of them.
Yes. And, there's a lot of pioneers out there in the dental field that are trying to get root canals to be a better treatment. Because what's the problem with the root canal? The problem with the root canal therapy is that it basically seals in bacteria inside the tooth. We are not able to clean inside the tooth. If we look at the anatomy inside the tooth, there are these little micro channels that are going sideways that nobody can clean up. And when a tooth dies, bacteria from the mouth actually goes inside the tooth, and it starts basically gassing off different bacteria and different toxins there. And it spills past the tooth into the jawbone, creating abscesses. So that's the real problem with the root canal. It cannot clean the tooth properly. So it's really, for root canal specialists, I mean, they're going in kind of blindly to clean. They're doing their best, but they don't have the tools yet. And, one of my colleagues is actually researching right now ways to clean the tooth better. So they're trying laser therapy. They're trying ozone. So far, it looks like ozone is actually not helping in cleaning the root canals better. So that's why, when you get a root canal, just keep in mind, bacteria may be sealed off inside the tooth, which can actually exacerbate and create a problem, not only in the mouth, but in the body. So I've had such patients with a variety of symptoms with root canals. I've had a patient, for example, that actually came in to remove her root canal because she became sensitized to everything. Like any kind of smells, even gluten. She said her husband couldn't even buy bread inside the house because she couldn't stand it. She would get so weak to the point where she couldn't get up from the chair. And once I cleaned up her mouth from root canals that were toxic and cavitations, which is essentially the same thing, bacteria trapped in the jawbone. Like within 6 months, she's like, oh my God, I can finally have bread in the house. I'm still not eating it, but my husband's so happy because he can at least bring it in the house. So I see remarkable stories. Once we remove the toxins, the toxin load on the body can heal. But, everybody's different. Everybody's genetic makeup is different. Some people might walk around with root canals that are all bad and they don't feel a thing, right? They're like, oh, I'm fine. There's nothing wrong with me. But there's people that get one root canal, and from that point, they get chronic fatigue, autoimmune issues, and all kinds of things. So everybody's genetically different. And if you're suffering from any kind of condition like that or chronic disease, definitely have a biological dentist check with a CT scan, any kind of infection underlying within the teeth or in the jawbone.
Where would someone find another biological dentist?
So the IAOMT website, it's IAOMT.org, is a great source to find a dentist in your area that is offering, a full checkup. And you want to call the office, just make sure they have a CT scan. Some people don't have a CT scan in their office, but they will send you somewhere to get a scan. And that's okay too. But it's very, very important. That's the only way for us to really see jaw infections is by taking a 3D CT scan. With nowadays, it's actually digital. So it's much less radiation than a traditional medical scan.
IAOMT.org for those of you that want to find someone you can go visit if there's something wrong with the root canal. But is there another option? Let's say a dentist says to you, you need a root canal. What other option does somebody have?
So typically, a dentist would say to you, you need a root canal for a couple of reasons. One, if a patient has sensitivity to hot and cold. When somebody has sensitivity to hot and cold, it means the tooth is still alive. And if you can endure the pain for another month or two, that sensitivity to hot and cold, then things can be done to help that nerve calm down. Another reason might be if you have really throbbing pain and you're swollen, most likely your tooth is already dead at that point. And my recommendation would be to remove it. Because if you're swollen and in throbbing pain, that bacteria is already all over the jaw. So we can't get it out. That's the thing. So that would be the two main reasons why. Actually, some dentists sadly recommend root canals preventatively. Meaning you have a big cavity, it's close to the nerve. Let's just do a root canal right now to prevent you from having any pain. But in fact, your tooth can heal. So let's say the cavity is close to the nerve or even into the nerve. Ozone can actually sterilize that opening into the nerve. We can actually put a little calcium hydroxide layer, and your tooth can actually build back tooth structure in that site to block off any kind of opening. So, of course, we do a filling or a crown, whatever we need to do. But I am totally not a big fan of killing the tooth unnecessarily just for prevention. But it is done out there.
Well, there are hysterectomies done for prevention.
Yeah.
We're removing whole organs for prevention because God knows you weren't born perfect and you don't need that organ anymore. So just take it out. It's the cause of all your problems. I'm being sarcastic, everybody, in case you can't pick up on that. So I want to go back to mercury because what I do is I forget as I learn, because it happened to me. I did a show with Dr. Elizabeth Plord, 4 shows actually, in 2016, maybe. I started my show in 2014. Actually, it was probably 2015. So at this point, that is 5 to 6 years ago. And we talked about how hysterectomy is overprescribed. So of course, that was 5 years ago. So I've learned it. So now I'm on my merry way and I've learned it and I've shared it with other people. And so of course, I assume everybody knows. And then I go to the doctor and she tells me to get a hysterectomy. And I looked at her straight in the face and said, that's not happening. And I wasn't in shock, but I kind of was. I was like, what year is this? How are you still doing this? This is not necessary. So for me, backtracking, mercury. So I learned, 15 years ago more, that mercury was toxic and that was one of the causes of all the brain dysfunction and Alzheimer's and memory loss and a whole bunch of things as it seeps into your tissues and having mercury toxicity. And I had taken a test to see how much mercury I had, gave it to my everybody. and I, of course, had some mercury toxicity. So I had my mercury taken out and put in porcelain. And I did a detox at the time also to remove it from my tissue. Now, I haven't done a test since. But I don't want to skip over the fact that I assume that everybody understands that. So let's talk a little bit about mercury, because there are people whose parents and grandparents are starting to decline and they don't know why, and their mouth is full of mercury. So let's talk about the effects of mercury, how to get it out safely, what you can do if you're not going to get it out, to whatever kind of other therapies one could do to remove it from the tissues, to try to slow down any of the deceleration and the degeneration that it has on your body. And then, of course, recommendations around mercury in general.
Yes, and actually a recent study came out saying that mercury, high levels of mercury affect heart health. So we do see a decline in heart health with people on high level of mercury. But, it's not the norm. I'm glad you went through all this. So did I. I grew up in Romania, so I had 16 mercury fillings in my mouth. So my mercury was off the charts. But at the time, I didn't even know that I needed to have it removed safely. So my friend did it. Not exactly the right way. So, to be mercury certified dentist through IOMT is important because we're able to isolate all that vapor coming off when we remove the mercury. So I went to get tested because I wasn't exactly feeling well. I was developing headaches for no reason. My mercury level was off the charts, and mercury is a neurotoxin. It does affect, for example, you can get more headaches, chronic fatigue, blurry vision, imbalance. Also, higher level of candida. We see that mercury is associated with that now. So people who are detoxifying were able to actually control the candida better. And besides that, mercury conducts certain electricity in the mouth. So I remember I had all these fillings, and I would put a fork on them, and then I would get a zinger. I'm like, wow, this is very interesting. So basically, when you have two metals in contact together in a wet environment, it's a battery. That's called galvanic current. And there's so much research on it. Galvanic current essentially drains your batteries of life. We have a certain limit on our life batteries. And when you have a battery going on in your mouth, it's bad. And we've had patients with symptoms, actually. They were getting headaches only on one side of the face, and mostly because they had metal crowns and metal fillings on top of each other, creating a constant current there. So it's so important to remove the metal. It's toxic for your energy. It's toxic for your levels. The mercury can be neurotoxins. So definitely very, very important. And also we find it now in Dr. Bredeson's book, The End of Alzheimer's. He talks about how important it is to get the mercury out to prevent Alzheimer's. Because through his program, he's been shown to increase the brain volume back up to normal once all the toxins are removed. So you're right. There's a lot of older people that say, I've had these for 40, 50 years. They don't bother me. Why should I take them out? But it's not the teeth that are the problem. It's the toxicity that's overall in the body. Because anytime somebody drinks something hot coffee, hot tea, hot soup, you have mercury fillings, there's mercury coming off that filling. It's been proven. There's actually a great video on the IAOMT website called The Smoking Tooth. Even if you rub it when you brush your teeth, mercury comes off the tooth. So it's very toxic. Even if you go to the dentist and the hygienist is going to polish your mercury fillings, you're going to get intoxicated with mercury because it does come off the tooth slowly. And nowadays with the testing that we do have, we can distinguish between inorganic mercury and the organic mercury that comes from fish. And our office does this. Some other dental offices do it as well. Depending on the state, there's different regulations. But we test it via not just in blood. Usually there's no mercury in blood. There's usually mercury in the tissue. So we have to test it in urine or in hair or as a challenge test. Different way of testing it. But we can figure out, how toxic are your mercury fillings to you, because, some people have a good detoxification system. So they might be able to clear out mercury better than others, which is another important factor to find out. But in general, definitely, I recommend everyone to just get rid of your old mercury toxic fillings. They're just not good for overall health.
The physician that created the testing product and the protocol that I had done 15, 17, 18 years ago is no longer doing that. And I know that I did the chelation process to take out the mercury, but I haven't gotten retested. So do you do the tests for mercury?
Yes, we do. We actually use a tri-test, it's called, and it's from Quicksilver. And the reason why I like it is because it helps us distinguish between the organic and inorganic mercury. And it's a tri-test, meaning hair, blood, urine. So we kind of compare all of them. And the reason why we do test the blood is to see people that eat seafood are you getting mercury from your seafood? Because it'll show up in the blood. And we have seen that, and we have to ask people, like, okay, limit the amount of seafood you're having, or at least, be just more conscious about what kind of seafood you are choosing for your food. Like if you're going to eat tuna every day, guaranteed your blood mercury level is high, because tuna is typically filled with mercury. Not all tuna, but the majority of it.
What would be the protocol for eliminating mercury and doing some kind of mercury detox?
So I love natural things. I love to detoxify naturally. So number one, definitely chlorophyll, anything that has chlorophyll, cilantro especially, like just eat a lot of cilantro if you can. If not, there's cilantro tinctures and tablets that helps to detoxify the mercury. And also chlorophyll drops that you can take with your water. That also helps with the detoxification. Sweating, like infrared sauna, that's a great way to detoxify. And drinking lots of water so your body can actually flush out these things. Because a lot of people are dehydrated, and if you're not going to drink a lot of water, how is your body going to eliminate any toxin for that matter? So yeah, these are ways. But oral chelation is one of them. So there's certain like EDTA, for example, that people can take, and tablets, DMSA. Those are usually prescribed, but it doesn't have to be. Like I like to really detoxify naturally. IV chelation, which I've actually done. Not everybody can tolerate that. It's typically done by a naturopath or an MD. And it's very important to monitor the minerals in a good way, because when we chelate forcefully, we're also taking out minerals from our body, such as calcium and magnesium. So it's very important to take a calcium, magnesium supplement while doing the IV chelation. So, your body can kind of replenish those levels.
Okay. Lots of good stuff for everybody to be looking into and doing. And we're going to continue that conversation. So in terms of, now we talked about the probiotics and cavities and gum disease. Is there anything we're missing on how we can help reverse gum disease or cavities that we didn't cover already?
Diet, I think it's an important factor, an inflammatory diet, besides the oral hygiene, taking the right probiotics. But when it comes to gum disease, for example, somebody that's eating like high sugar levels, and what do we mean by high sugar? It doesn't mean that you're just going to have like cane sugar or processed foods. Even for example, people who eat like fruits from morning till evening. And I have seen those patients. Fruits are still sugar, especially some of them are higher sugar level than others. So really the recommendation is cut your sugar level, whether it's from natural sources like fruits, just eat 1 serving of fruit a day, not 10, for example. And also certain carbohydrates are considered sugar, especially they're very carcinogenic. For example, but like bananas can be very carcinogenic. Even like bread, certain breads that are maybe more natural. So even if something is all natural, doesn't mean it cannot create cavities. That's very important to know. So just because something says all natural doesn't mean it's good for you. Fruit juices, for example, also not something I recommend. I mean, it's still high sugar level, even though you're drinking like carrot and orange, which I actually have seen patients come in like, I'm very healthy. Look at the things I'm drinking. And I'm like, oh my God, so it does feed the pathogenic bacteria. So I think just choosing things that are low in sugar, and especially nowadays, we have such good sugar alternatives for people that are trying to get off the sugar, such as allulose, for example, using that as a sweetener, at least till we kind of wean you off the regular sugar. It's very important, not just for cavities, but also for gum disease and for overall health. We know, sugar actually increases inflammation, which is what gum disease really is.
Obviously, this is an important conversation to be having because we all have teeth. And it's not just about necessarily what you look like. So what I was told, and I forget who told me this, it was recent, and it had to do with, like, I'm talking about like being I hate to say victim of a dentist or of a car repair person who knows you don't know anything and they're prescribing all these different things. I've heard that a lot of cosmetic dentists do that more than people who are more sort of on the preventative health side. And I don't know, I'm not targeting anybody. I just heard that was sort of, be careful of cosmetic dentistry because again, it feels like the focus is just what you look like and making, your mouth and your smile look good. But really at the root of all dentistry is the overall health and what it means and how it reflects our current digestion and state of health. And what bad teeth do cause in terms of our gut. Like it goes from the gut up and from the mouth down, right? It's both directions.
Absolutely.
For the health of our mouth. I mean, I'm about ready to get my cat's teeth cleaned. I've never gotten an animal's teeth cleaned, but I understand the benefit of it. And I've seen other animals of other people who, after they extracted a rotten tooth, the animal's health, totally changed. Now, my cat doesn't have anything going on necessarily. I don't believe we're going to need any extractions, but I'm doing this preventatively because she's 8. Yeah. And I'm like, all right, I know she needs a teeth cleaning and I want to extend her life out. So I'm going to get her teeth cleaned now to help, again, not to get rid of any negative bacteria that's there that could be hurting her or degenerating her in the future. So I think that sometimes people don't equate that. They don't get that bad teeth also means bad health. And then the teeth can also reflect something that happens, like you were talking about, in the gut.
Yeah, absolutely. So what happens with bacteria in the periodontal world, we know that it affects the joints. There's an increase in rheumatoid arthritis, for example, and we do find bacteria in the joints. It's related to the unborn baby. It travels to the placental fluid, and we know that it can actually cause low birth weight babies, for example. These are studies done in the 1980s, 1990s. It can affect the lungs. People can get respiratory infections. Of course, the nasal and the sinus areas as well. Now we're having studies, especially bacteria associated with cancer, oral bacteria, which has been just in the last 5 years, published studies and numerous studies, not just 1 or 2 articles. Colon cancer has been linked to periodontal disease, esophageal cancer linked to periodontal disease, prostate cancer, breast cancer. I was just reading some articles this weekend on breast cancer associated with periodontal disease, because that bacteria travels, and we know some of them actually create this communication, a genetic, basically, release of certain chemicals in that cell to create it to become cancerous. So we know there's an association there. So it's not just for the mouth, just to have a good smile, but it's really, I see so many holistic patients that don't realize that importance that you just mentioned. They do everything holistically. They eat right. They buy the most expensive water, but when it comes to their teeth, they're like, I'm fine. So I think it's important to realize what kind of problems we can have just for not taking care of our teeth properly.
Well, you'll be hearing from me. I want the test of my saliva test. I'm getting the gum. I want to know the probiotics. I want a probiotic for my teeth to help balance that out. And it's too bad you don't take pets, or I'd bring all my cats to you.
My cat is actually 14 years old. He's doing still very well, but he has to get his teeth cleaned.
Of course. Yeah. Well, I'll be sending you my partner, Doug. He will be coming to you before I see you personally, but I definitely, if I can order the gum and order, and I know that's at Orasana.com, right? Yeah, not the gum, the mint.
Send you some product. We'd love to hear your feedback and see how you feel about it.
Definitely. Oh, I'm excited. And because it's an easy tool. And we know the microbiome is being studied in, there are probiotics for every part of your body it's, from your mouth to your anus, there's a probiotic that can help all of that. And we talked about that in some of my past events that I've done, live events. Jeannie has presented at most of them. And we've done everything from brain health and hormone health and probiotics and all that good stuff. So I appreciate this connection with you. Thank you so much for coming on. And I hope that everybody checks out BeverlyHillsDentalHealth.com as well as Orasana.com. The links will be in the show notes for those of you listening to the podcast, and the links for those of you that are watching this are underneath this video. And I appreciate that I'm giving you a resource now for all of you that know that, just like me, sitting in that chair with an archaic body of information that hasn't caught up, and I don't know what took me so long, but that's okay, because we're here now. And now you have ways to help improve your oral health and to do it in a way that is connecting the dots to this, again, idea of gut biome and probiotics and overall health, and not just the most expensive thing that you need to do for your mouth. The teeth are important for multiple reasons. It's part of the whole health picture, and take it seriously and try these things. I know they're going to work because I trust Jeannie and I trust Dr. Sanda without even knowing her past this interview, which is an hour, and doing a little research on her. So thank you so much for coming on today. Is there any last words of wisdom that you'd love to give anybody, Dr. Sanda?
Oh gosh, I just want to tell everybody, your dental bills don't have to be hugely expensive. There's a lot you can do at home, and that's why I created Orasana. We have an optimum oral health package. I encourage you to try it. It'll change the health of your teeth. I have a lot of great reviews from people that are just using that in itself. So, don't be discouraged. I think a lot of people get discouraged, and I see people, I was like, I've tried everything and nothing's working. I'm still back in the same place. But don't get discouraged. Just continue doing what you're doing. You'll definitely see results by just incorporating some of the things we talked about.
I appreciate it. Thank you so much, Dr. Sanda, for coming on. I look forward to meeting you soon.
You too, JJ.